This short video is on the rehabilitation of iliotibial band syndrome. We will aim to keep this video as short as possible, but without compromising on vital information. If you are watching this for the second time, then we suggest you skip the short theory section and go straight to the rehabilitation exercises. The exercises are grouped into the stretching or mobilizing type and strengthening type. So let's begin with that. What I want you to do is lie on the floor with this on your thigh, on the lateral aspect of the thigh. Okay, now let me just warn people that this can be a little bit uncomfortable at the beginning, but this discomfort does subside if you are regular with the exercise. It's only at the beginning. And also one advice is to do small amount of movements in one area and then progress to another area. So you do a few rounds here, a few here, and a few there, so that we get maximum effect. Yeah, something like that. So put it around your foot and grab it with both hands. And lie back for me.
Like straight?
Yeah. On the floor, yes, completely. Raise the leg nice and slowly up, as far as you can comfortably do it, but challenge yourself a little bit, yeah? And so you feel the stretch in your leg, yes. Yeah? Now, in a slow motion, tilt it in the other direction, feel the stretch on the outside, keep the tension on the band, pause for a few seconds, and then in a controlled fashion, go back to the neutral position. Don't forget to breathe, yeah? Mm-hmm. And then, again, pause it.
How many seconds should I hold?
Take it as far as you can manage it, because we want to challenge the iliotibial. How many seconds? About 5 seconds. But everybody's different. But obviously, you want to be within the comfortable limit. Yeah. So we do a few repetitions like this, maybe 10 repetitions, depending on your sensitivity and whether you are just starting the exercise or you've been doing it for a few days. Good. Cross that foot over the other leg, okay, a bit more like that, and using the power on this leg, push this leg right over like that. And I don't want you to roll the whole body, so if you open your arms, you stabilize the upper body, okay. And you can vary the angle of your knee. You can bend it a bit more if you want. Pause for a few seconds, go back into the neutral position, and tilt again. Start again, Andrea, with slow motion so we can see the actual components. Good. Pull it over like that. And keeping your arms open stops you from rolling as well. Pause it for a few seconds. Slowly go back to the neutral. Okay, the next exercise, it's in the standing position, and it involves you crossing the legs over like that, flexing forward, and towards the direction of the back leg. Can you show us again in that direction? Like this. Okay. And pause for a few seconds and then up again. Andrea, for the next exercise, what I'd like you to do is find a wall, a steady surface like over there. Maybe you stand up there for me like that. And cross over one leg right on the other side so that we are stressing basically that side. Yeah, we're stressing that side. Yeah. So in fact, you can put this a little bit further forward like that.
Okay.
That's it. And I want you to throw your pelvis in that direction towards the wall. That's it. Do it within your limits because it's quite taxing on the hip and your spine. And some patients won't be able to do this because of coexisting conditions with their hips or their knees or their ankles or their spines. But if you're able to do this, pause on it for a short time, then go back to neutral. Again, throw your pelvis towards the wall and stretch the outside aspect of basically this leg. Yeah. The next exercise is very similar to the previous as well, but if you are not happy holding onto a wall, you can use actually a nice steady chair with, again, the legs crossed over like that, and just tilt your body holding onto the chair like that. So the next one, it involves using a wide chair, or if you have access to a gym, one of those benches in the gym, which is basically around this height. Yeah. So let's use a chair in this instance. What I'd like you to do is put one leg on the chair, cross it over, provided your knee is okay. If you have pain in the knee, you don't do this exercise. Like that. Yep, excellent. And flex the whole body, not just your head, but the whole body in that direction. Where do you feel the stress at the moment? Around. Yeah, it stresses your glute and your piriformis, but the ITB as well. In fact, it'd be nice to have your knee a little bit more straight, if you can. That's it, yeah. Okay. Now repeat again the procedure in my direction.
You do.
Hold it for a few seconds and then repeat it again towards your toes, more or less. That's it. And hold it for a few seconds, yeah? Is your knee okay in this position?
Yeah.
All right, flex towards the knee, hold it, and then mid position, and then again towards the toes. I would suggest you stay a bit longer when you're doing it for real, like at least 5 seconds, but now we are sort of speeding through the exercises. Okay, what we've done so far, we've gone through several stretching exercises for the iliotibial band. Then, once you are ready, we're going to progress onto the strengthening, the stabilizing exercises, and we're going to start with simple things, yeah? Raise the leg straight, and yeah, you feel you're engaging basically the tensor fascia latae, one of those small muscles on the outside, the tensor fascia latae. You're using some of the glutes, you're using some of the hip muscles, like the vastus lateralis there to do this exercise. To enhance it a bit, Andrea, when you come up, rotate your foot like this, and then go higher. So by rotating the foot downwards, you are tensing, you are engaging more that aspect there as well. You need to put the band around both legs towards the end.
Just above the ankles, right?
Exactly.
Okay.
And roll onto your side facing me. Are you comfortable on the floor?
Yep.
If your hip is bony and the floor is too hard, then I'd suggest you put a towel or something soft so that you're not irritating that bit there. So what you're going to do in a slow, controlled fashion, try and open your legs like scissors, pause it, and then go back down. Yeah. A lot of people try and do this by using momentum up and down, up and down. No, we want to pause them. We want to do some isometric contractions. And then again. Do as many as you like until you start feeling that you've actually achieved something. If it's too easy, then you're not maybe engaging the muscles. The next one is called hip hikes. And what it involves is actually standing on one leg with the other leg bent, pushing away. And that actually is good, not just for strengthening, but for stability as well. So it helps you to build stability, but also to strengthen the side you are standing on. So for that, you stand on one leg, you bend that knee, you put the foot backwards, and then try and drop your pelvis within the comfortable range, yeah, because it's quite a hard exercise. Obviously, you're quite fit and you can take it a long way down.
I can feel it.
Most individuals can't do that far. And then gradually go back up again, and then again. So we're actually using all of these muscles on that side, isn't it? You demonstrate.
Would it be a problem if I put the foot on the floor?
If you're unstable, it's fine to do that just for a bit of stability. But try and also train your stability, so you're doing two things at the same time. If you're not stable, if you're an older person, this would not be easy to do. So maybe you can hold on to a steady surface while you're doing it, just to gain a bit of stability, because we want to focus on the exercise itself. The next exercise, again, uses an elastic band, something similar to this. And again, it's a strengthening exercise. And you're going to walk sidewise like this, but with the elastic band being held under constant tension. Take strides that stretches the band to a little bit of tension. That's it. And then bring that there. don't close the leg too far to drop the band onto the floor. So keep the tension while you're doing that.
Should I keep the leg straight or bent?
No, I think a little bit of flexion on your knees. Yeah, it's good for that. If you are not balanced enough for that, you can open your arms so that you can gain a bit of balance. Yeah, that's good. Obviously, if you've got a bit more floor surface, you can do it to the end of the room and back again. Yeah, that's good. Thank you very much. And finally, the last exercise in the strengthening series. So do you want to demonstrate that for us?
Feet together?
Yes, push your feet together so that we're just using the thighs, holding a bit longer for me when you open your legs. Additional advice for iliotibial band syndrome. If the region is inflamed, then remember the acronym RISE: rest, ice, compression, and elevation. Build up exercises gradually. Wear good supporting shoes. Use arch support if necessary. Massage and stretch the affected area. Use hot and cold compresses. Topical application of anti-inflammatories. And seek professional advice. Causes of ITB syndrome. Physical factors include a quick increase in activities, new activities, no warm-up, weak muscles, ITB tightness, downhill running, and others. Types of sports that cause ITB syndrome, amongst others of course, running, basketball, skiing, climbing, cycling, weightlifting, and others.